Hey, we're back with Dr. Kardie Tobb from Cone Health, and she's talking about women's heart health and what steps they can take to be healthy. And so where we stopped was, all right, what happens if you have a little one, you're experiencing less sleep and more stress while recovering from childbirth? What do they need to know about their heart health?
So the one important thing is if you're on medicine for high blood pressure, we want you to continue taking your medicine. If there are barriers where you have and you can't get your medicines, express that to your healthcare team. They'll find a way to help you. The most important thing is try to get a network system with your family, friends. Take time off for yourself, an hour or two in a week, just to recuperate and get some stress relief. But ideally, stay with your medications, stay with a healthcare plan, and follow up as you are able to.
All right, so Cone Health, they have a whole new heart disease clinic that is going to be open specifically for childbearing women. So kind of talk us through the high points of that.
So we're really excited because our clinic is going to be opening on May 13 in our medicine for women building. And this clinic is going to cater to the needs of our local female population. First, those 3 steps I talked about earlier before pregnancy, we want to see you and see what your heart disease risks are. See if you have high blood pressure, diabetes, if you've had heart failure in the past. We want to take care of you during pregnancy. Make sure you're on the right medicines. Make sure you and the baby are fine. And after pregnancy, we want you to stay home and take care of your family and not be coming back in the emergency department because your blood pressure is high. So we want to follow you during that time, hopefully up to a year. But we want to make sure women locally have that lower risk for what we call cardiovascular mortality, meaning dying during or after pregnancy, and make sure our local moms are also healthy as they go through childbearing age.
All right, so let's kind of talk about on the big picture. What are the signs or the symptoms that all women need to be aware of that would indicate to them, you know what, I really need to contact my health provider?
The first thing I tell all women is know where your normal healthy baseline is. What that means is know how you are every day. So if something starts to come up where if it's chest pain or you're just feeling tired, you're having fluttering of your heart, then you're able to contact a healthcare provider. Don't wait until it's worse or it's too late. Contact us early and we're able to help as soon as we can.
I think that for us as women, I know that we pay attention to our bodies, but I think we dismiss things very often. So how do we know when it's something that I really do need to contact someone versus, oh, I just feel like tightness here, or I feel like, you know, there's a bubble of air there, or whatever?
So the first thing is, if you're out of your normal state and you're having that for a day or two, I would make a phone call to my primary care provider, or, you know, ask the woman to make a phone call to a primary care provider for a short time.
Go ahead. I think your Zoom froze for just a minute, but we're back with you, so that's all good. A few technical glitches.
So what I was saying was, don't wait for a long time. If you feel out of your body, you feel like you're not your normal self, and you feel chest pain, shortness of breath, sometimes the symptoms doesn't escalate. It comes for a short time and go away. I really would talk to the healthcare provider about it if I was the female experiencing that, to make sure that I'm not presenting late, because sometimes we wait too late that things happen and we can't change it, the course of it. But I would say contact early.
Yeah, I think if you would tell your friend to contact the doctor, then you should contact the doctor, right? All right.
Yes, ma'am.
You recently published a paper about the low percentage of women who participate in clinical trials about heart disease, despite it being the #1 killer or a leading killer of women worldwide. So tell us about your findings and why this is like really concerning.
So me and my co-authors did a literature search and published a paper looking at how many women are participating. It's heartbroken because this is the thing that's killing us. The #1 killer of women is heart disease, but 38% of the participants in research study are women. The rest are men. So this is concerning because all the medical advancements, most of the medical advancements that are being used from the literature for men on women, and our bodies are built differently. So that is a concerning fact that we're not even half of the participant in research studies.
Okay, how important is it that women then, so then it really is way important for people to participate in those trials. Are there any plans in the future for clinical trials for women at Cone Health?
So we're looking into different possibilities. We have a study that we're hoping to get grant for to look at women postpartum, meaning after pregnancy, hypertension, and see how we can help locally change the spectrum of that and how social factors can affect that. So hopefully that will be coming in the pipelines.
Okay, and we've got just about 1 minute left. Can you address some of the key concerns about women participating in trials? Maybe we can dispel them.
So few of the things that we discover from the aspect of the women are, the first thing is lack of awareness. A lot of women are not aware that clinical trial is happening and that they can participate in that. I would urge women to encourage other women to ask their primary care provider, their healthcare provider, look on clinical trials.gov and see how they can participate and give back. The second thing is a lot of women are not willing to take risk. They're afraid that, oh, if I participate in this study, I'm going to be having some problems. So I would urge women to really talk to the healthcare provider, because we can give you more information about different studies. And when it comes to minority women, it's been historically a trust issue. So we have to educate over time and ease women into these different processes so they understand that it's safe and they're helping with saving lives.
Fantastic. All right. Thank you so much. I hope that dispelled some for folks, so when they see it come up that they do take part. Thank you so much for your time. If you missed any of this information, you can find it in the To Your Wellbeing section of our website.